Perfect. Okay, before I get started, I want to say thank you to Jimmy and Voxel51 for allowing me to showcase VIGIL. And if you hear any background noise, I'm sorry. There are actually people working in the lab right now on VIGIL as we speak. It's all about progress here in the Corso lab. So let's get started. Okay, what is VIGIL? Vectors of Intelligent Guidance in Long-Reach Rural Healthcare. This is a project that's supported and funded by ARPA-H. And as you can see at the bottom, we have all these schools that are helping accomplish the same goal. We have Michigan, Central Michigan University, UPenn, Colorado State, Rochester, Northeastern Purdue, and Stevens Institute. Now, before we get started, I want to show you guys an image, or I guess, introduce myself. My name is Andrew Krikorian. I'm a first-year doctoral student in the Department of Robotics at the University of Michigan, and my PI is Dr. Jason Corso. I'm sure many of you know who Jason Corso is, but if you don't, he was recently awarded the Toyota Professor of AI, and he is a great mentor, friend, and, well, a CSO of Voxel51. Let's continue. So I'm sure many of you guys have seen similar images on social media or on the news or on TV, but a lot of people like to use this as an evolutionary guide of what is going to happen next. So you have the ape-like figure to the caveman to where we are now, humans, and the next step being physical AI. But the issue here is that we think at the VIGIL team, there is an intersection between humans and robots right in the middle. And this is something that we have many terms for, but I will just call a metahuman. Basically, a human that is using AI to become more efficient or effective at a specific task or job or a hobby. And we term this upskilling. So we will be using this term a lot throughout the presentation. And another term that's basically equivalent to this is intelligent task guidance. So this presentation is very high level. There isn't too much research, but there's a lot of research that supports these downstream tasks to be able to perform such cool things with AI, whether it be vision or language or physically grounded AI. Okay, so visual AI in healthcare. This is why we're here, right? So what does the future look like? Well, I'll give you a quick glimpse into what we think the future can look like in that stage 4, where we are upskilled by AI. First, you may be a radiologist and you'd want an AI system to highlight suspicious regions in the chest x-rays to prioritize critical cases faster. You may be a nurse and you'd want an AI to monitor your patient movements and provide feedback so that if something happens to a patient, you can react quickly. Maybe you're a physical therapist and you want AI to help your patients track movements when they're doing physical therapy at home so that they can perform these exercises correctly. Maybe you're just a physician and you want AI that integrates visual data, such as images and scans, which we heard within the past 2 presentations, with patient history so that you can make more informed decisions. And of course, we can't forget about the administrators. They keep the cog running. And as a hospital administrator, maybe you'd want AI to automatically triage imaging studies so that these urgent cases are reviewed first. So let's get into VIGIL. What is VIGIL? What's the motivation? What contributions are we bringing? And what's the current progress? Well, we have a graph here, and this graph is basically outlining a bunch of regions, which they call HPSAs in the United States. Now, the green regions are non-metro, micropolitan regions, and then you have metropolitan regions in blue. The higher the score is on the chart, whether it be, or the darker the shade, basically tells us there is a need for healthcare here. This is generally speaking in rural areas, there's a higher need of healthcare, which is why you see a lot of blue throughout the United States. So our motivation is that patients must travel 8 times as far today for inpatient care compared to a decade ago. And the issue here is that many communities face critical shortages of specialized trained physicians that need expert guided care for specific tasks, right? So our goal here is to increase the reach of healthcare throughout all of America. It is 2026. Everyone should have access to healthcare. So what is our contribution? Well, we are under the Paradigm project supported by ARPA-H, and our goal here is to make what's called a care delivery platform. A care delivery platform is basically a vehicle that can go drive around in rural healthcare areas and provide or give access to people who need it the most. And there are 5 technical areas within this project. The first 2 being medical people that are actually creating the requirements. The second being the people building the actual platform, such as this on the right side, the CDP, and then you have a bunch of people working on the electronics, and we are technical area 5, where we are upskilling medical generalists to perform specialized procedures. So the idea behind this is that there is a shortage of specialized physicians. So what do? Well, we have a large supply of medical generalists. Why not upskill them using AI so that they can perform these specialized procedures in time, just in time, right? Right then and there without having too much background knowledge. Now, obviously, we have the assumption that, well, they're medical generalists. They understand some of the terminology and how to be safe and go about these procedures. But generally speaking, most of the cognitive load is mitigated through our VIGIL system. Okay, so in our system, we currently support 3 different tasks. So the first task is cardiac echocardiogram. Basically here, we are trying to guide the generalist through an echocardiogram to estimate the LVEF, the LVEF being the left ventricle ejection fraction. So now for the people who don't know what an echocardiogram is, it's basically a test that uses high frequency sound waves, like ultrasound, to create real-time moving images of the heart structure and function. And what we do is we look at the function and the heart structure through time, and we can calculate this LVF score. And this LVF score basically tells us how healthy your heart is. So this is the goal for our first task. And in the VIGIL system, we've decided to simplify this task into 5 steps that a generalist can follow easily. The first step is positioning the Oh, okay. The first step is, if it wants to, I don't know if you guys can see my screen.
We see your screen and I think you're stuck on guidance 1, positioning the patient.
Okay, this is something just happened where it just stopped sharing my screen for whatever reason. I will show you guys a video and I will walk you through the steps. So we have 4 steps. Oh, again, wow, this is great. I don't know what's happening. My computer is acting up today. There we go. Okay, I don't know why. Yes, okay, great. We have the first step being positioning the patient, right? You have to remember you're a medical generalist and you've never done this ultrasound before. So we have to show you exactly how the patient should be positioned to get a good image. And we do this using a novel method, or a physically grounded novel method, which is a projection system. I'll show you guys the video after, as my Google Slides is acting up a little bit for some reason. The second step is preparing the actual probe. Remember, you've never done an ultrasound before. So where do you put the ultrasound gel? Where do you put the probe? How do you do all of these things if you've never done it before? Of course, we use projection here again to target a specific region and then tell you to place the ultrasound gel and how much to place on that region. And once you've placed the gel, we use visual context to understand the scene and then move on to the next step, which is fine grained probe guidance. Now, this fine grained probe guidance is the actual task of using the ultrasound, going about the chest, for instance, since it's an echocardiogram, and getting a good image of of the heart. Now, we need a good image because we want to calculate the LVEF, and this is the 4th step. Once we have enough images for a fine-grained probe guidance, we will estimate the LVEF using a model. Now, you have to remember all of these things are using models in the back end, and we'll talk about that later. But a lot of these models are custom fine-tuned. If you want to ask about the models, feel free to. This is very high level, but please ask any questions you guys want in the Q&A section. And the last step being the drafting an EHR. Basically, there's a VIGIL agent that listens throughout the whole conversation and the whole task and jots down all the important things the patient says, all the important things the generalist says, and of course, the high quality ultrasound images. Once all those things are collected, by the end of the task, we create a draft EHR. Of course, we won't consider it a full EHR because this is the medical field. We need to make sure everything is perfect, as we heard a lot from Dan. Okay, let's see if we can walk through this. No, it's not letting me. I want to show you guys. Yes, here we go. Okay, so on this screen, you're going to see on the left side and the right side, there's a couple things. It's a lot of colors, but we'll walk through it quickly. In the third step, we have fine-grained probe guidance. We have never touched an ultrasound, and we do not know how to get a good image of the heart. And believe me, I've tried. In the first couple of weeks I was onboarded onto this project, it was pretty difficult. So we have a couple models here. On the left side, we have two models. The green frame, which you'll see right here. There's a green frame around the ultrasound, and this is basically a stoplight classifier, a CNN that looks at the ultrasound image and gives you either red, yellow, or green, telling you if the ultrasound is of good quality to calculate this LVEF. And then on the ultrasound, remember, we've never done an ultrasound. We don't know what the heart structures look like. So we decided to create a legend that landmarks each component of the heart. So you'll see the left ventricle as pink, right ventricle as yellow, right and left atrium on the bottom as orange and green. And then on the right side, you'll see a 3D model of the probe. Now, to get a good image, you have to slightly rotate and move about the chest with this probe, and it is extremely difficult if you don't know what you're doing. So we decided to gamify this specific part of the fine-grained probe guidance. So you'll see a 3D model here, and you'll see this solid axis, which is the current position of the probe using an IMU. And oh, you can't really see in this video, but I'm sure they'll show it again. In this IMU, we take this IMU information, send it to our VIGIL agent, and the agent basically displays a transparent axis. Oh, there we go. You can see it right here. The transparent axis, which is the target orientation of the probe. You basically want to move the ultrasound into this orientation to get a better image of the heart. And once all these steps are done, we collect about 15 great images, and our system generates an LVEF score or estimates an LVEF score. Now, let's walk through what the VIGIL agent does. So you are a medical generalist and you've never performed an echocardiogram, so you may want to ask a couple questions. Well, we have a VIGIL agent that is basically a fly on the wall. It's listening to the conversation, jotting down the important details, and when it comes to the generalist asking a question, such as what's in this view, because I've never seen this structure before, it'll tell you an answer, such as this image here. You'll see it says there are reverberation artifacts suggestive of lung being in the view. Basically, after this is said, you'll ask, how do I get a better view? And VIGIL will give you a good response. Now, this is the patient positioning step. As you can tell, there is a projector that is projecting directly onto the bed. This is our novel form of physically grounded guidance. Now, we say physically grounded because, well, we are in the digital guidance, I would say, era right now, as everyone is using ChatGPT, Claude, Gemini, all these different tools to, make their emails better, make their papers look better, all these different things. Well, the step between this and robots walking around is what we consider a physically grounded guidance. Now, this is a form of it where we display the patient pose directly onto the bed and have the generalist position the patient correctly. Now, once the patient is positioned, they'll move on, and this is the part where you have gross probe guidance. Basically, this is the target area where you should put the ultrasound gel. Remember, we have to walk through each step of this process, holding the generalist's hands as they have never done this before. So again, we'll project a specific target area box onto the patient, and then you place the ultrasound gel there. And once the VIGIL agent sees that it's placed the ultrasound gel, it will go on to the third step, which is a fine-grained probe guidance. And we can move on here, and this is a live view of the fine-grained probe guidance. As you can see on the left side, we're moving from red, yellow, green, basically telling us the image is getting better. And once this part is complete, we'll get an LVEF. And once we get the LVEF, the procedure is basically over, and the VIGIL agent can continue creating the draft EHR. Now let's go back to the Oops, there we go. Okay, so this is the echocardiogram case. Now, we have something very similar for the lower limb deep vein thrombosis case. Our goal here is that we need to guide the generalist through a deep vein thrombosis diagnostic to estimate a Wells score. Now, a DVT, or deep vein thrombosis, is basically the same as using an ultrasound to create images of blood vessels. It's usually done using compression down the leg, and it's basically a diagnostic of measuring the presence of blood clots. Right. So in this case, it kind of follows the structure of the last case, which is the echocardiogram, since we're using an ultrasound and we have very, very similar tasks. So we'll position the patient. This time the patient will be in an upright position, and the projection system will dynamically orient itself correctly and start projecting onto the leg instead of the chest. You have the probe preparation, which again, there's a target area that's on the leg, and you place the ultrasound gel there and place the probe there. Once the probe is placed, the VIGIL agent will move on to the next step, and you have fine-grained probe guidance. The issue with this case is this fine-grained probe guidance is a little different. And when I say that is that you are actually performing multiple ultrasound scans throughout the leg. So you'll have many stops throughout the leg, and at each stop, you are collecting images, making sure they're high quality, moving on to the next stop. Collecting images, you're going to hit every major vein down the leg, and once you're at the bottom, you can estimate this Wells score. So the third step, we consider it a loop. Basically the same as the echocardiogram case, but you'll perform 5 to 7 times. This is a much longer diagnostic, but it's basically the same in how we provide the guidance. Of course, there's a Wells score estimation for the fourth step, and then the draft EHR preparation in the last step. Now, I'd like to introduce you to a new task that we've taken on, which I'm very excited about because the guidance vectors are really different and the steps are really different, right? So we are trying to push physically grounded AI as far as we can. Our goal is to lower the cognitive load, remember? So we have a medical generalist. They are trying to perform these tasks with the lowest amount of cognitive load, basically offloaded to this VIGIL agent, which tells them exactly what to do. So in this X-ray positioning and capture case, we are guiding the generalist through an X-ray procedure to capture a high-quality image while ensuring safety. This is an important key of this task, ensuring safety. This is where a lot of the guidance goes towards. So in the guidance vectors, or the steps, we have the first step, which is constraint fulfillment. Now, maybe you guys have had an X-ray before, or maybe you haven't. When you go into an X-ray, they'll ask questions such as, oh, did you eat? Do you have jewelry on? All these different things that basically are ensuring the safety when the X-ray actually is performed, right? So I will show you a video after, as maybe we can try this one. Oh, great, this one works. So we'll walk you through the first step. So as you can see, there's a projection on the wall, right? This is a standing X-ray. Instead of it being on the patient bed, we have a standing X-ray, and we're using this projector again. Now, all these icons that you're seeing are different constraints that must be fulfilled. This is the first step. So what's cool about this specific case is that we use the full capability of VIGIL, where we use visual context to check off some of these constraints, right? You can't really know if someone's eaten food without asking them. So that one, will tell the medical generalist to ask the patient, hey, have you eaten food? If so, great. The VIGIL agent will hear and mark that as green. Other things, such as if the medical generalist has their lead apron on. Of course, we're taking an X-ray. This is all about ensuring safety. So the generalist must have their apron on. And of course, a collar. These are all leaded. This is for safety. And the VIGIL agent is basically looking about the scene and seeing if these things are actually on the medical generalist. Of course, we have a system that can distinguish the patient and the generalist and use visual context to understand which constraints were fulfilled. And if they are not fulfilled, it won't allow you to move to the next step without fulfilling the constraint. Now, the second step is preparing the medical instruments. In this, it's a pretty simple task, right? Where you're basically taking an X-ray. The issue is that this X-ray has to be perfectly aligned with the region of interest, right? So this requires positioning the patient again, but this is a different form of positioning. So I will show you guys in this video how we go about positioning the patient here. Well, we have a center line that goes down in the middle, and this line is basically telling the patient where to stand. Now, as you can see, these are some of the people that are working on the projection team. We have this whiteboard. It's supposed to act like the X-ray detector. I don't know if you've been to an X-ray, but some of these standing X-rays have an X-ray detector that basically bounces the waves off and brings it back to the X-ray machine so that they can capture the image. And now you can see we're segmenting the user's body and finding the center line of the body. And we're using real-time guidance to show, oh, red, yellow, and green. Once it's green, we're basically aligned with the center line, the target area, as we call it, and we can move on to the next step. So the next step in this case is holding a specific bar. We are just simulating this. There will be a bar in the real CDP. Again, everything is dynamic and it is following the user's body. So once the user is aligned with the target areas, we move on. We bring the X-ray detector back, and the X-ray is automatically aligned with the center, the region of interest, and it captures the image. And of course, the VIGIL agent will look at the image, tell you if it's high quality, and if you need to take another image, it'll ask you to take another one, and that is the fourth step. Now, I do want to show some cool pictures. I know I'm close to time, but I'll show some pictures of some demos that we've done and all the people that are working on this. This is a really large effort. We have 10 different schools pumping out many papers for different things. We have so many user studies. How do we lower cognitive load? How do we provide effective guidance vectors? All these different things. I think the coolest thing to highlight is we brought in a bunch of engineers from the robotics department and told them to perform an ultrasound, an echocardiogram on Yayuan, the patient you're seeing here. And many of them were able to complete the task within 10 minutes. People who've never touched an ultrasound before, people who don't know how to read these images, which we thought was very cool and a great sign that we're moving in the right direction. And then, of course, the DC demo day, we went to DC and showed off a lot of the things that we've been developing. And soon we'll have another demo day, which will show a new task, which I can't tell you guys now, but maybe we'll have another talk to talk about that fourth task. And then, of course, I need to acknowledge all the people that were on this project. So many students, PIs, mentors, medical PIs, all these people. We appreciate your work, and I cannot wait to see how much more we accomplish in the next 3 to 4 years. So thank you so much. And if you have any questions, please.